Occupational Safety and Health Administration, OSHA, to adopt an emergency temporary standard immediately on emerging infectious diseases, because currently no such enforceable standard exists nationally. California, through Cal-OSHA, has the protective aerosol transmissible diseases standard, which must be thoroughly enforced and held as a model to ensure that our nurses, other healthcare workers, their patients, and our communities are safe. We are continuing to monitor agency action closely and look forward to working with local, state, and federal agencies to implement our recommendations, the nurses' recommendations, to combat COVID-19. I'll be available after the press conference to answer any technical, regulatory, or policy questions. Thank you for your time. Now I'd like to turn the mic back to Bonnie.
Thank you, Jane. All right, we would like to conclude the speaker portion of the press conference by sharing National Nurses United's demands to Congress and this administration. So number one, ensure all nurses and healthcare workers receive the highest level of protection in their workplaces. Number two, improve the Center for Disease Control screening criteria and testing capacity to ensure prompt recognition of and response to new cases. Number three, promulgate an emergency temporary standard through the Occupational Safety and Health Administration to protect healthcare workers from emerging infectious diseases as soon as possible. Number four, ensure that any vaccine or treatment that is developed with U.S. taxpayer dollars is provided to the public for free. Number five, act immediately to pass an emergency spending package to fully fund the response to this outbreak, and that means dedicated funds for protective equipment for workers, temporary paid sick leave, and coverage for all treatment care and services for people with potential COVID-19 infection. As union nurses, it is our duty to speak out on this issue to protect our patients, the public, and each other. Thank you, and now we would like to answer some questions from the press.
Hello, I'm going to help facilitate this portion of the event. For folks who are on the phone, media folks on the phone, please press 1 now, and the operator will let us know who is on the phone who wants to ask a question. I would like to ask all the media, when you're asking a question, to begin by identifying your name and the media outlet that you represent. So we're going to start with some of the folks in the room while the people on the phone get ready to ask questions. Are there any of the TV reporters in the back who have a question that they want to ask? No? So let me go to our radio folks. KCBS, go ahead. Okay, I'm sorry, KQED, please go ahead.
Well, we have more than 80 that are under quarantine. The statement that was read to you is an anonymous nurse who is symptomatic after caring for a positive patient, and CDC is refusing to test her. Well, so I don't know what specific cases you're referring to. For our members, we are entitled to information from the employers. Now, that we've had some difficulty with that, with some employers not, giving us that information with regards to what employees, specifically our members, are out on quarantine. Now, they're legally required to do that, and we are, working and pressuring them to do that, to follow the law. I don't know if there's anything more to add, Jane, on Solano County in particular, but yeah. Go ahead.
I have.
Go ahead.
Folks that are on the phone, to please, you need to press star first and then 1, star 1. And again, to the media, when you're asking a question, again, please identify yourself and your media outlet first. Thank you, Jane.
In addition to what Bonnie said, be clear, the CDC is starting to walk back some of their recommendations on healthcare workers who've been exposed to confirmed COVID-19 cases. They are starting to say they have actually changed the guidance on their website to allow healthcare facilities to have workers who've been exposed to a known case continue to work until they develop symptoms. That is irresponsible, and that is completely inappropriate guidance. Based on what we do know about this virus, asymptomatic infections are occurring. Asymptomatic infections are infectious. All healthcare workers who've been exposed should be on that at minimum 14-day quarantine off work, paid. And more importantly, I think that situation underlines the care facilities to have in place all of the isolation, screening, protections that they should already have in place, but it underlines the importance of those and the exposure from happening in the first place.
You can stay. That's fine.
Okay.
Yeah, just in case there's more.
Yes, please speak into the mic, please, because so.
This is a national survey, but
Please identify yourself.
Oh, Margie Schaefer with KCBS. I know this is a national survey, but here in California and also in Washington State, can you break out those? Because these numbers are frightening. I mean, are the people that are actually dealing with the bulk of the patients, are they saying the same thing that's reflective in this survey?
Yes, yes, and we can California numbers for you, and we can do that after this press conference. Absolutely, yeah.
Is there another question in the? Do we have any questions on the phone?
Yes, you have a question from Dana Goldstein with New York Times. Your line is open.
Hi, thanks for taking my call. Is it your impression that the CDC is dialing back the recommendations in terms of protective gear or even when to quarantine just because of concerns over lack of access to this gear or just lack of number of nurses? In other words, why would they be changing these recommendations in your view?
Well, that's a good question. Why? Because what we know in the science, we've been through this before. So, you know, we've had rehearsals, we've had H1N1, we've had Ebola. We know that you have to hit it hard up front and have the highest levels of protections not start to lower. Once you lower, spread will increase dramatically. We know this. So it does not make sense to us that they would be lowering these standards at this time.
Who just spoke, for those of us on the phone?
Oh, I'm sorry, that's Bonnie Castillo.
Okay, thank you.
Another question on the phone.
You have a question from Lenny Bernstein from Washington Post. Your line is open.
Hi, thanks very much for taking my question. I'd like to direct this to Jane Thomason. So you mentioned some dissatisfaction with management of various hospitals, and we do have a fairly decentralized medical system. But you also said that the federal government should have been warning you weeks and weeks ago about things that you should be doing. Could you specify what kinds of guidance you would have liked from the federal government and what you didn't get?
So, yes, the CDC has been, specifically the CDC has been reactionary rather than proactive. It has taken the judgment and expertise of astute clinicians within facilities to identify the first community transmission. The CDC, by all reports, refused to test that case that turned out to be positive. The CDC has been behind the ball at almost every step of the way, and now we have received information that they are continuing to walk things back rather than taking the leadership that they could be taking to demand and to recommend recommend that all healthcare providers, all healthcare facilities, all healthcare facilities have in place the measures that could be preventing the need for use of PPE, right? So all of those measures that could be in place, the engineering controls, if you want to use some more technical language, the screening and isolation, making sure that all patients who present with symptoms of respiratory illness, that COVID-19 is considered for those patients, making sure that they are isolated, that no one else in that, say, emergency department waiting room is exposed, even though they are there for, say, their child's earache, right? Those kinds of measures could be put in place. And that is a significant piece of preserving the PPE for when it is needed. What we are seeing and hearing from our nurses is that their employers don't have those measures in place. And so the fact that the CDC is walking back on their PPE recommendations in order to, quote, preserve PPE supply is concerning when there are many other more protective measures that could be in place. And we expect the CDC to take that kind of leadership to make those recommendations for those healthcare facilities.
Thank you.
Thank you. Is there another question on the phone?
Yes, we have one from Samantha Cielo, Capital Public Radio. Your line is open.
Hi, this is Sammy Kayula. I saw an announcement this morning that Assemblywoman Lorena Gonzalez is introducing legislation to protect workers from retaliation if they take leave during the coronavirus epidemic. Could anyone speak to whether you know of nurses that have been penalized for staying home sick or just staying home because they feel they've been exposed?
Well, what we know, especially in the non-union settings, we are hearing from nurses that they are specifically prohibited from speaking to anyone, including the press, about what they are experiencing. And as we know, they do not have a protected voice. And so if they do speak out, they can be fired at will. So this is, every state, varies in terms of any of their state whistleblower protections. And in some cases, they don't have any. And even in places like California, we're hearing where we do have some whistleblower protections, we still are hearing from non-union nurses who are afraid to speak up because their employers may terminate them.
Okay, any comment on the bill that's been introduced?
What?
Any comment on the bill that's been introduced that I just mentioned?
Well, we look forward to working with Assemblyman Gonzalez on, and we'll be reviewing her legislation and hopefully be supporting that, because clearly we want to make sure that, not only our members are protected, but that all nurses are protected.
Thank you.
We have time for one more question on the phone.
Okay, we have a question from Simi Areo from LA Times. Line is open.
Hi, just a quick question. This anonymous statement that you read, did you say what hospital that nurse was at?
Kaiser. We said Kaiser.
Okay, Kaiser Roseville?
We did not say Kaiser Roseville. We just said Kaiser.
Okay, got it. Okay, thank you.
We'd like to thank all the media who have taken time out of their day to be with us today. We're going to end the formal press conference now. We will have a little bit of time for people that are in the room if you have time to stay and you have additional questions for follow-up. Thank you all very much for being here.
That's okay. No, just for those in the room, we have additional nurses from UC Davis, UCSF, and we also have somebody from our nursing practice department who can take questions, so if you guys want, as well as Jane and Bonnie and Kathy.
And does the innovation guy know that he knows that we have the great job? Really, really excellent. You need to fix your shirt. Oh, God.
stand in the middle.